Dr. Peter Paige, Chief Clinical Officer with UVA Health. He's sitting down with Casey.
All right, thank you so much, Steve. Thank you so much for taking the time to be here today.
Thank you for having me.
Yes, we are happy to have you. And we're talking about the importance in the relationship between a patient and their doctor when it comes to receiving the best care. How important is that relationship?
You know, it's really critical, the patient-physician relationship, especially ongoing. You know, there needs to be honest, open communication. There needs to be a confidence and a trust between a patient and their physician. And when you think about what patients tell physicians, there are occasions where they don't tell us all that they should. And sometimes that's because they feel embarrassed, they feel like it's a foolish question. We want to relieve them of that burden and have them just feel free talking to us about whatever they like.
Yeah, you're right. It's something that is so important. It helps you receive better care. When should patients maybe consider seeking a second opinion? And how should someone bring that up with their primary care doctor?
You know, it's really more patient driven. So oftentimes patients are a little bit confused and don't have a clear understanding of what the doctor is telling them or what the plan is or what the treatment options are. And so if a patient has a lack of confidence or a lack of clarity around the plan, they easily should seek a second opinion. Another area is if they have a rare disease, like a very rare malignancy. There are places that treat those exclusively, and that they may seek out care at a different place to get that level of expert care. Another big factor is reputation. You will see health systems and hospitals that have great reputations. UVA Health is one that we do. We honor second opinions from patients across the country and across the world based on a lot of it on our reputation.
What would you say are some of the biggest benefits when it comes to getting a second opinion?
Well, one is definitely that you can come out of a second opinion with a lot more confidence and clarity about what's going on and what your treatment options are. And, you know, and that really drives your participation in your treatment plan when you understand it, when you understand it and can support it in your mind. I think the other big thing is that sometimes you can get care that you may not get with the original opinion. For example, there may be an expert treatment, there may be an alternative treatment, there may even be research trials that you could enter into based on the disease process you have that you may not even know about with your primary doctor.
Yeah, so a lot of benefits to seeking a second opinion, but there are some things people should be mindful of when it comes to maybe insurance coverage, other things like that when you're getting a second opinion. What do you think people should know?
One thing is that you should definitely check with your insurance provider. Most do cover second opinions, but you obviously want to know if they're going to cover it, how much they're going to cover, and if they're going to cover it for the specific reason that you're seeking a second opinion. I think the second thing is that sometimes logistics become a challenge, and if it's going to be a different geography, you're separated from your family. It may be expensive if you have to go and stay there for a period of time, so you need to entertain that as well. And third, you hope that your primary doctor supports, understands, and agrees with you getting a second opinion. You should be honest and open about why and have that discussion. Sometimes it can obviously challenge that relationship if that's not well received.
Yeah. All right, really good stuff. I know there was something else you wanted to add real quick before we go.
I just wanted to wish all the physicians out there happy Doctors Day on Saturday, March 30th, and obviously especially those my colleagues at UVA Health. They do a great job every day, and we really want to thank them.
Yeah, they really do. We are so fortunate as a community to have you all here. Thank you so much for all you do.
Thank you.
Yes.
Thanks for having me.
Yeah, we'll have you back soon. And Steve, back over to you.